Good morning, everyone, and let me start by saying that it's a real privilege to be participating in this event and panel. I think to the words of Mr. Kapetanakis as he concluded his presentation, the collaboration and the dialogue that is in place here says a lot and witnesses the progress. Being able to sit on that panel, and I remember last year we were sitting together, and congratulations on taking on the presidency of HESMO. It just shows how year on year we have such a progress of staying very focused in building a patient-centric healthcare system and cancer care in disrupted times. Because to the word of Mr. Minister, the times have never been more disrupted, but they've to some degree always been some form of disruption. So the ability to keep that focus is so important. And the data that we see confirms how this is important. You've touched on it as an introduction. I mean, if we take a 30 years lens, the American Cancer Society published some recent data of a reduction over 30 years of mortality by 30%. And furthermore, interestingly, they published, the fact that if we look at patients diagnosed between 2015 and 2021, the relative survival rate for all cancers is now reaching 70%. Up from around 49%, 50% 30 years back. So we clearly see when we take a long-term lens that what we're doing collectively is generating progress. And there is an acceleration over the last 10 years, a great acceleration, as we move from relatively conventional, important treatments to really novel targeted therapy, immune no therapies that are really transforming the way cancer is being treated. And therefore, I think it's so important to have that focus on what do we do going forward. I couldn't talk better than the presenters have now talked about their priorities. If we look at and I like to frame them around the European Beating Cancer Plan, which has been a fantastic framework to help us to accelerate, whether in Greece or across Europe, around prevention programs, where there's been a lot happening in Greece under your leadership, whether on screening programs. Greece has now multiple important screening programs, including recently some more risk-based programs in lung cancer, for example, whether it's the biomarkers, and it's an area that was very close to Mr. Minister's priorities a few years back, and it wasn't easy to make it happen because those are important decisions. Let alone, and this is where Greece is doing a lot of progress when we look at the broader again landscape, is how to really think about data digitalization from the providers to the caregivers to the patients. And I think you just touched on it around how do we really work through collaboration and data to build up an infrastructure that is going to enable all of you, including industry, to make best decisions. Because I think there's clearly over the last years, and the focus needs to remain, there's been a lot of progress, in particular in clinical research. A company like ours, when I took on responsibility for Europe, in Greece we had 6 clinical trials in oncology. Today we have 80 trials running in Greece with innovative molecules, combination, etc. in cancer care. And that's the result of that dialogue. That's the result of a combination of policies, of great investigators and scientific leadership, which Greece is really recognized for, and then industry effort. Now, where do we go from there? And I think you both touched on it, is the importance of data, the registry, the work that is being done, and the multiple programs announced last night. I was having discussion on all the work that is happening in Greece around data, AI, Project Pharos. How do we really build an ecosystem around data that is going to enable us to move from not only very strong clinical research, and even stronger, hopefully, in the future, to really being able to leverage real-world data? Because you touched on it briefly, I mean, and it was discussed, just the fiscal constraints. I mean, they're real. I mean, we can't deny them. And I think the ability to, in the future, look at all those combination treatments, earlier diagnosis of cancer, which requires, different approaches, we're going to have to be able increasingly to know what works and what doesn't work, and to do it with very high pace so as to be able to align all of the intervention across the patient care pathways for better outcomes. And I know there are going to be further presentations in the afternoon. So in a difficult time, I have to say I'm an optimist. I'm an optimist because of that dialogue. I'm an optimist because it's one of the strengths of Greece is really bringing around the table various stakeholders, and not necessarily agreeing on everything, but constantly looking on how do we progress, because at the center there are patients waiting. And I can tell you, traveling across Europe, Greece is definitely making significant progress thanks to those dialogues and to multiple actual measures being put in place. It's not only about having those dialogues, but multiple actions. And the National Cancer Plan, which is one that indeed we've discussed for some time, but seems to be really coming, is going to really strengthen that.